Our brain is a center of thought, feeling, memory, speech, vision, hearing, movement, and so much more. It sends messages through our spinal cord and nerves to transmit information to our entire body. But certain diseases of the brain and the spinal cord can block the normal flow of electricity and signaling. Now, there are safe, new, and effective ways neurosurgeons at Catholic Health Services can diagnose and treat problems in the central nervous system. That's on today's episode of CHS Presents Lifestyles at the Heart of Health. Advanced image-guided navigation and treatments like brain mapping, available at Good Samaritan Hospital's Medical Center's Brain Lab, have greatly improved the outcome for patients with brain and spinal cord tumors. Joining me now is Dr. George Kakalides, who is a neurosurgeon at Good Samaritan Hospital Medical Center. Welcome. Good to have you here.
Well, thank you.
So what is brain mapping?
Yeah, so when we talk about brain mapping, we're talking about mapping out different functional areas of the brain. They're very often referred to as the eloquent areas of the brain. And in particular, we have a brain here. We're talking about mapping out areas responsible for motor function, sensation, vision, hearing, even speech as well. And the whole point of mapping out the brain is to, when you have a tumor, you want to remove and resect as much of the tumor as possible without causing excess harm. So you want to be able to map these areas out beforehand in order to resect the tumor safely.
Okay, so you're talking about, I know, like all these little colors in this brain represent different areas that have different functions. But when you map them out, is that meaning like you're literally taking somebody's brain and saying, here's where this part is, here's where this part is, etc.?
Yeah, so there are many different ways you can go about it. Some are done before surgery, some are actually done during the surgery, during what's called an awake craniotomy. When you're doing it before surgery, mapping out the brain, and I'm sure you're familiar with this, what's called functional MRI. It's when a patient goes into the MRI machine, they are told to move their hand or wiggle their toe, and then that area of the brain lights up, and that's where you can see where that area that's responsible for hand movement or leg movement. Additionally, there is another kind of MRI called DTI that maps deeper subcortical areas of the brain, the white matter tracts. And there's also the gold standard, which is called electrocortical stimulation, and that is actually stimulating the brain during the surgery and seeing if the function is inactivated or not. So you have a patient, you tell them to either count or name, and if they have a speech arrest during this time, that's when you know that is the area that is responsible for speech.
But so, did you just say people are awake during this brain surgery?
Yeah, so people get worried about that. Even patients are scared at times, but they are awake during the surgery. They often tolerate it very well. We have a team that is involved in doing that, including a neuroanesthesiologist who is often there and helps participate, puts the patient to sleep, wakes them up during that time. There is also a neurologist that sees the patient beforehand, goes through the certain tasks that they're going to be asked, and when the patient is awoken during that critical part, both the surgeon and the neurologist are there to talk to the patient and ask them certain questions.
Does this mean that everybody's brain is a little bit different about where we have certain functions? Isn't there like a general guidebook about a brain?
Yes, good question. We have a general idea of where each function is. So if we look at the brain here, this is the front of the brain, the back of the brain. The motor cortex is generally located here in the frontal lobe posteriorly. The area for speech is generally located here in the inferior frontal lobe, called Broca's area. Another area for speech, for understanding speech, is in the area called Wernicke's area. And in general, we have an idea of where that location is, but each individual differs. And that is why we use electrocortical stimulation, which is actually stimulating the brain to actually test out to the exact millimeter where that specific function is in each individual patient.
Wow, that's amazing. I know that at Good Samaritan, brain mapping has saved a lot of lives, including that of a local resident whose name is James Brush. He was able to walk his daughter down the aisle on her wedding day. Let's take a look.
Just 1 month before his youngest daughter's wedding, 62-year-old James Brush learned that he had a brain tumor. He needed immediate surgery.
I had woken up and I had some slight slurring to my speech with a slight, I don't know how you say it, it was a discomfort on my left-hand side.
After surgery, Mr. Brush completed radiation therapy at Good Samaritan and is optimistic about the future.
Yeah, I walked my youngest daughter down the aisle. I danced with her, danced with the granddaughters. You know, it was a good day. People at Good Samaritan who have been some of the best people I've ever met in my life. I can honestly thank them for helping me and getting me on the right track, and I think we're going to be in a good place going forward.
Oh, what a beautiful story. Isn't
Yeah.
that great? Those
Yep.
success stories must just make you feel so good
Absolutely.
as a surgeon to have that actually work that well.
Yes.
Curious, I don't know what his recovery time was, but what typically is it?
Yeah, so this process of brain mapping really doesn't add any extra time to the actual recovery. Typically, for brain tumor removal, patients are home by day 2 or 3 after the surgery. Some patients even day 1. So this technique really doesn't add any extra time to the recovery at all.
But what it does add is an ability to ensure as best you can that they're not going to lose any functions because of the brain surgery.
Absolutely.
And I'm just curious, is everybody that's eligible for brain surgery, is everybody a candidate for this, or are there some limitations?
Yeah, so generally both adults and even some children can participate in this. It really depends on the patient's ability to cooperate with the specific questions they are being asked. There are some pathologies where the patient is so debilitated they cannot cooperate. In that case, obviously, no. But the majority of patients can participate.
And is it tumors for most everywhere in the brain, or just specific areas?
Yeah, so this is used for many different what are called lesions. They're used for tumors that originate within the brain, which are tumors like glioblastomas, meningiomas, tumors that originate from other areas and metastasize to the brain. Additionally, this can be used for vascular lesions. There are these benign vascular lesions called cavernous malformations.
Sure.
They can be located near an eloquent part of the brain, and it can be used for that. There are additional other vascular lesions that tend to bleed called arterial venous malformations. The technique can be used for those lesions as well. And then there's a form of epilepsy called lesional epilepsy. And that is where there is a focus where the epilepsy originates from to cause seizures. And when you're going to remove that, if it is in an area responsible for speech, you would want to know that beforehand and avoid that area. So it can be used for epilepsy as well.
So there's literally like a little lesion that is causing the epileptic seizure?
Yes, yes.
Wow. So the patients then can vary vastly.
Yep.
And the only thing is that if they're in a debilitating state, so they can't
Exactly.
answer and can't be awake during the surgery. And the success rate of this sort of surgery now is, I imagine, far greater than it ever used to be.
It is. We can map down to a millimeter or 2, that precise, and greater than 98% of the time, 99% of the time, patients usually do not have any sort of recognizable deficit.
Oh, that's an amazing
Yeah.
thing. You talked about the motor strip of the brain. Can you describe for me again? I mean, was that this main kind of section in here?
So yeah, it is. So it's this section here in pink in the posterior frontal lobe, and each of the area along that motor strip is responsible for a different movement. One area is responsible for hand movement, the other face movement, the other leg movement. So it's very important to know when there's a tumor there where that specific area is.
Where do you see this brain mapping going in the future?
Yeah, so that's a very good question. So right now we are close to, like I said, 98% precision. Hopefully with all the other different types of brain mapping that can be included, we can reach 100%.
How many of these surgeries do you end up doing in a year's time?
So we end up doing about 20 to 30 in a year. Sometimes, and that's for tumors. It could be more, upwards of 50 for other lesions as well.
So basically one a week or more than that?
Just about that.
And how long are they literally on the table, or
Yeah,
I don't know if you even know call it a table anymore.
So it really depends on the type of lesion. If it's a tumor and it's a large tumor on the surface of the brain, they can be there for an hour and a half for the surgery to be completed. If it's a tumor that is more deeper within the brain, that could last upwards of 8 to 9 hours, or even more sometimes.
And they're awake during this?
They are awake for a small portion of that.
Okay.
So the way it works is the patient is, we have the team involving the neuroanesthesiologist, the neurologist, and even the monitoring team. Once the patient comes in, the anesthesiologist puts them to sleep, but does not put a tube down so they can breathe. So they're breathing essentially on their own. The anesthesiologist, after the brain is exposed, both the place where the lesion is and also where you're going to map. Once that's exposed, the anesthesiologist then wakes the patient up, and
that's
the
when
patient,
you ask the questions and try to
exactly.
determine exactly where.
What function, exactly.
Interesting, fascinating. Stick around. We're going to have more on this discussion in just a moment. Going to take a break. We'll be right back after this.